Now we will be seeing about mechanism of menstrual bleeding, right? So as we all know that in absence of pregnancy corpus luteum degenerates and corpus luteum secretes which hormone? Progesterone. So we say that in absence of a pregnancy, steroid hormones level begins to fall due to degeneration of corpus luteum. Decreased steroid hormone levels cause increased coiling of spiral arteries and their constriction. It results in decreased blood supply, which in turn leads to ischemia of endometrium. So what does the ischemia of endometrium will result in? It will result in destabilization of lysosomal membranes and release of proteolytic enzymes from lysosomes, correct? And also release of prostaglandins, mainly PGF2 alpha, correct? Loss of blood supply and action of proteolytic enzymes initially produced focal area of necrosis and which later on fused to form large necrotic areas in the endometrium. Prostaglandins, what is their role? They induce smooth muscle contraction. It results in the beginning of menstrual bleeding. Because of presence of proteolytic enzyme, menstrual blood does not form clots. Remember this thing, menstrual blood is unclotted blood. Normal amount of menstrual bleed is 30 to 130 milliliter. So what do we said? We said there is absence of progesterone in absence of pregnancy or when fertilization and implantation does not takes place, corpus luteum degenerates. Steroid hormone levels begin to fall. This results in two results. What are those? More coiling of spiral arteries. Correct? And their constriction also. Then it will result in what? Decreased blood supply to endometrium. And what will this result in? Ischemia of endometrium. Correct, na? Then what does this ischemia will lead to? Disturbance in lysosomal membranes. And what? Release of a compound called prostaglandins. Which is the main prostaglandin released in this case? PGF2 alpha, correct? Then loss of blood supply and action of first what will happen? Local areas of necrosis will form. Then these fuse to form large necrotic areas. These prostaglandins, what they were doing? They will cause smooth muscle contraction. And because of this contraction, the blood, the eroded layer will go down, it will pass through the vagina. Menstrual bleeding will initiate, onset of menstrual bleeding. Okay. Because then you can mention because of proteolytic enzyme menstrual blood do not clot. Normal is 30 to 130 ml. Fine. You can focus here. Is it visible? Okay.